Aloha, Monica here from monicaswanson.com, and today I'm excited to be introducing my husband Dave to you all. We are doing something different and we're really excited that you're here to join us because it's a Saturday morning. We're sitting here having our coffee and we thought we would jump on to share some basic family health tips, some summer safety tips, I guess. Dave is a doctor, and I've always wanted to kind of bring him in to answer some questions. Some of what we'll be talking about you might already know, but we're going to open it up with a little quiz to see what you do know, and then let Dave share his top 5 summer safety tips. So first of all, Dave, say hi and tell us what kind of doctor you are.
Hello. I'm board certified in family practice, and I'm a hospital physician. Hospitalist is the term, and I take care of patients that come from the emergency room, too sick to go home, they get admitted into the hospital, and hopefully I get them better and send them home.
So he knows a little bit about everything, which is super helpful, except when we're sick here and he's not around, he's at work. But most of the time he can answer a lot of questions. And so I'm going to open with a quiz. You gather your kids or spouses or friends, see if you can answer, and then Dave will tackle them just a little bit further in his 5 tips. So first of all, number 1 question. 1 in how many Americans will have skin cancer in their lifetime? Do you know the answer to that? That's number 1. Number 2, what is more likely to be the cause of death in children ages 1 to 4? A swimming-related accident or a car-related accident? Ooh. Number 3, what difference does a helmet make in the risk on the risk of serious head and brain injury when riding bikes? What difference does a helmet make? Does a helmet make a difference? If so, how much? Number 4. This is an A, B, or C multiple choice question. Are you ready? You feel thirsty, A, before you're dehydrated, B, after you're dehydrated, or C, when you've eaten too many potato chips? And then number 5, what are 3 signs of infection? If you have a cut or scrape, or your kids do, what are 3 signs that it is an infection that you need to call a doctor for? Alrighty, so we're going to turn to Dave.
So those aren't multiple choice, you actually have to know
right, only the one is
the
multiple
answer.
choice. I just made these up.
Okay.
Does that work?
Yeah.
Okay, so we've
Just
got the
harder.
doctor, it's harder. So I hope
The answer's not
I hope you have your thinking cap on.
choices.
Okay, so he's going to start with the first, answering our first question. 1 in how many Americans will have skin cancer in their lifetime, and then talk to us about summer safety and skin cancer.
A lot of these weren't multiple choice, so they're all hard.
No, right, they're all hard. I like to challenge people.
Well, you might
1 in how many?
1 in 5 Americans will be diagnosed with skin cancer in their lifetime.
So what can we do to avoid skin cancer this summer?
Well, the one thing you can do is wear sunscreen. And if you wear sunscreen routinely when you're outside, apply sunscreen frequently, then you can reduce your chance for skin cancer potentially. And for those of you that have light skin, red hair, blonde hair, green, blue eyes, family history, or you even have had skin cancer in the past, you're outside a lot, all of these are risks for skin cancer, or something that can increase your risk for skin cancer. So all the more reason to put on sunscreen.
Or to wear like long sleeve shirts, hats, glasses, right? That's even better.
Even better.
Or stay out of the sun.
Or just stay out of the sun as much as possible.
Okay, very
And don't
good.
ever go into a sun tanning booth.
I might have grown up where it was very cold and rainy, and I have deep regrets, but I did tanning booths in high school.
You can't go back in time, but
You can't. I wish I
you
could.
can go forward.
I'm going forward. Going forward with number 2. And so 1 in 5 people skin cancer. That's a really scary statistic. Okay, what is more likely to be the cause of death in a child age 1 to 4? A car or a swimming pool?
Swimming pool. Yeah,
Okay.
tragically.
So tell us about summer safety swimming pools or the ocean.
Yeah,
Rivers.
everybody wants to be in the water getting wet during the summertime, but be careful. If you have children, make sure that you watch them. Supervision is probably the most important thing of all. people that don't know how to swim, and usually little kids, that's going to be the risk, is not having the ability, and the supervision's not there. And then sometimes barriers aren't there if you are near a body of water, a swimming pool. If you're at the ocean, there's just lack of protection from children being able to crawl or walk into water and get in a dangerous situation. So just be aware of those issues.
And it's hard. I mean, I know when I'm like in a social situation, I'm like talking to friends, and just in such a quick moment down at the ocean, you turn around and like a toddler is, near, the waves come in. So just so important to never take for granted that your kids are okay.
Absolutely.
All right, so swimming pool, super dangerous. Be careful this summer. Number 3. Question was, what difference does a helmet make on the risk of serious head and brain injury when riding bikes? What difference does it make? What's the statistic?
Well, the statistic that I know of is that you can reduce your chances by 85%.
That's a lot.
For getting a serious head injury, significant brain injury, if you wear a helmet. There are different types of helmets. Go to your local bike shop and they can point you in the right direction. But
skateboarding too.
Certain helmets are like certified for protection from significant brain injury based on how they're constructed. Yeah, so whatever you're doing that involves the potential for falling and hitting your head, whether it be on a bike or skateboarding or inline skating or whatever your activities are this summer, just be sure to think about wearing a helmet.
Okay, and then number 4 question was, this is multiple choice. I love multiple choice. You feel thirsty when? A, before you're dehydrated, B, after you're dehydrated, or C, when you've eaten too many potato chips?
Well, I think studies have been done. I actually did a dehydration study when I was in residency on soccer players out playing in the field and halftime, how they were doing in terms of body weight loss. But if you lose 1 to 2% of your body weight in water, so water losses, you may not feel thirsty until you've gotten to that point. So you can actually lose quite a bit of water before you actually have a thirst.
And that's dehydration. 1 to 2% would be.
Yeah, you're already dehydrated. So if you're thirsty, you're already dehydrated, and
too late.
You need to be drinking fluids. Well, it's not too late. You need to just.
You're dehydrated.
Yeah.
If you're thirsty, you are dehydrated.
Right, and there are risks that will increase as you go further with that. If you don't drink fluids, you can become exhausted. You can get heat exhaustion, and if you get nauseous, dizzy, feeling increasing weakness, you're potentially getting sick, and you can even get heat stroke, which is the most severe form of, I guess, a problem associated with dehydration, and that can be life-threatening.
So if you're outside sweating, most importantly for summer safety is just make your kids drink water. And if they're sweaty, there's a lot of kids that do summer camps or soccer training or, all day out in the heat. Lots of water, right? And electrolytes, like something with some...
Yeah, electrolyte replacements
Gatorade
are probably reasonable. Avoid stuff that has caffeine in it.
If you drink coffee, drink water.
Because caffeine's a diuretic. It makes you go shishi and you can get more dehydrated. And alcohol as well.
Shishi is a Hawaii word for number 1. Pee. Urine, we say in this medical family. Shishi. There's your Hawaiian word of the day. Doctors even use it. Okay, sorry, number 5. We're trying to be fast. And you're doing really good at not using too big of words, too. I told him he had to talk like the rest of us and not use big doctor words. Number 5, I don't even need these. What are 3 signs of infection? A kid gets a scrape or a cut. When is it a concern?
Yeah, so my thought was that kids are outside playing during the summertime. If they're like my kids, you're going to get cuts and scrapes. And if you do, be on guard for the signs of infection. And skin infections oftentimes present with increasing redness around the area of injury, swelling, increasing pain. Now, if you get fever, that's even more of a concern because you could be developing an infection that's getting systemic or into your bloodstream. And especially if you start feeling malaise, lethargy, and so forth. So get to a doctor if any of those things develop, because you probably need antibiotics because these infections are caused usually by bacteria, and the best way to treat that is with antibiotics. So.
All right. And speaking of calling a doctor, Dave is a doctor, but this does not replace your own family doctor or medical advice. So
Are you trying to
I'm trying to give a
do
disclaimer.
a disclaimer?
Isn't that what we
Yeah,
have
I'm
to
just
do?
saying that this is advice on the internet.
That's
But yeah, if you ever have a serious medical concern, or you're thinking you're having a medical emergency, go to your nearest emergency room, call 911.
There we go.
And you'll be hopefully okay.
Yes, we hope so. And so here is to a safe and healthy summer. And you know what? I think this was really fun having you. Thanks.
This was fun.
This was fun. And we would love it if you left questions or thoughts or topics and you can challenge him. He knows a lot more than this. We're just scratching the surface. So he's really smart. And we would love to tackle some future medical questions. Also, I'm going to ask Dave to come on and talk a little bit about being a dad. I know that I do a lot of writing and a little talking about parenting and being a mom, but Dave is willing to talk to us a little about being a dad and raising boys especially. So leave questions. Please do subscribe to this YouTube channel and leave us a comment. We look forward to seeing you again real soon. Aloha and happy, safe summer.